Hello students. Before we move on, please like, share and subscribe the channel. In one very important information, if you want notes of this video, check the download link in the description box. Thank you. Let's start. In this video, we will study BPCC-111. Understanding Psychological Disorders. Previous year question in Most Important Questions. 1. These questions are very important for your examination. If you read all these carefully, you can definitely clear the exam. Let's begin. Question 5. Discuss the causal factors in management of intellectual disability. Question explanation. This question asks you to explain the causal factors, behind intellectual disability, both biological and environmental. It also asks you to describe how intellectual disability can be managed or treated. Your answer should include definitions, types of causes, and intervention strategies or programs. Answer. Introduction. Intellectual disability, ID, earlier known as mental retardation, is a developmental condition characterized by significant limitations in both intellectual functioning, reasoning, learning, problem solving, and adaptive behavior. These limitations appear before the age of 18. It can affect educational, social, and personal aspects of life. Understanding its causes is crucial for effective management and support. This answer explores the major causes and discusses management strategies. Main body. IGNOU. Definition and classification of intellectual disability. Intellectual disability is defined by an IQ below 70 along with deficits in adaptive functioning. The American Association on Intellectual and Developmental Disabilities, AAIDD, classifies ID into 4 categories: mild, moderate, severe, and profound, based on severity and functional ability. Though, causal factors of intellectual disability. The causes can be divided into biological, environmental, and socio-cultural. A. Biological causes. Genetic disorders. Conditions like Down syndrome, Fragile X syndrome, and phenylketonuria, PKU, are known to cause ID prenatal factors. Exposure to infections, example, rubella, substance abuse by the mother, alcohol, drugs, or malnutrition during pregnancy can affect brain development. Birth-related injuries. Lack of oxygen, perinatal hypoxia, premature birth, or low birth weight may lead to intellectual impairment. Postnatal factors. Brain infections, like meningitis, head injuries, or exposure to toxins such as lead can also result in IDB. Environmental and psychosocial causes. Neglect or abuse. Lack of stimulation or emotional support in early childhood may impair cognitive development. Poverty and malnutrition. Chronic undernourishment and poor health conditions can affect brain development. Lack of access to education. Especially in underprivileged settings, children may not get proper intellectual and social stimulation. C. Socio-cultural influences. In some cases, cultural deprivation, language barriers, and low parental education levels may contribute to lower cognitive performance, though these are often reversible with intervention. Teen. Management of intellectual disability. A. Early intervention. Programs like IGNOU, Individuals with Disabilities Education Act, in the USA focus on early assessment and support for children below the age of 3. Services include speech therapy, occupational therapy, and special education. B. Special education. Customized educational programs based on individual needs. Use of visual aids, simplified instructions, and individualized learning pace help children with IDC, behavioral therapy and skill training. Applied behavior analysis, ABA, is often used to teach daily living skills and manage behavioral issues. Social skills training improves interaction and independence. D. Family support and counseling. Parents are trained to handle challenges, use positive reinforcement, and advocate for their child's rights. Support groups reduce emotional stress and improve family functioning. A. Vocational training and community integration. For older individuals, vocational programs help develop work-related skills. Sheltered workshops and supported employment allow for semi-independent living. F. Medical and technological support. Medication may be used for comorbid conditions, like epilepsy or ADHD. Assistive technologies like communication devices or learning apps can enhance functioning. Conclusion. Intellectual disability can arise from a range of biological and environmental factors. While it poses lifelong challenges, early identification and comprehensive support systems can greatly improve the quality of life. With proper management, individuals with ID can lead meaningful and partially independent lives. An inclusive and empathetic society plays a key role in their development. If you need the notes of this video, there's a download link in the description box. Be sure to check it out. Thank you. Let's see the next question. Question 6. Describe the clinical features and causes of panic disorder. Question explanation. This question is asking you to explain what panic disorder is, what its main symptoms, clinical features are, and what factors, causes, lead to its development. You are expected to include both psychological and biological perspectives and use examples or theories if possible. Answer. Introduction. Panic disorder is a type of anxiety disorder characterized by sudden and repeated episodes of intense fear known as panic attacks. These episodes occur unexpectedly and are often accompanied by physical symptoms such as chest pain, dizziness, or shortness of breath. This disorder can significantly affect a person's daily functioning. In this answer, we will discuss the clinical features and the key causes of panic disorder using both biological and psychological perspectives. Main body. Ache. Clinical features of panic disorder. Panic attacks. The hallmark feature is recurrent, unexpected panic attacks. These are intense episodes of fear or discomfort that peak within minutes. Physical symptoms. These attacks are accompanied by at least 4 of the following symptoms: palpitations, sweating, trembling, shortness of breath, chest pain, nausea, dizziness, chills or hot flashes, numbness, and fear of dying or losing control. Cognitive symptoms. Individuals may feel detached from reality, derealization, or fear they are going crazy. There is a persistent worry about having another attack. Avoidance behavior. Many individuals begin to avoid places or situations where they previously experienced an attack. This can lead to agoraphobia, a fear of being in situations where escape might be difficult. Impact on daily life. The fear of having a panic attack can interfere with personal, social, and occupational functioning. It can lead to isolation and depression. Though, biological causes of panic disorder. Genetic factors. Research suggests a hereditary component. First-degree relatives of people with panic disorder are more likely to develop it themselves. Neurochemical factors. Imbalances in neurotransmitters like serotonin, norepinephrine, and GABA are associated with panic symptoms. Brain structures. Studies show overactivation of the amygdala, the brain's fear center. Also, abnormalities in the hippocampus may affect memory of fearful events. Hyperactive autonomic nervous system. Individuals with panic disorder may have a highly sensitive nervous system that overreacts to stress. Teen. Psychological and cognitive causes. Cognitive theory, Clark, 1986. According to David Clark, individuals misinterpret normal bodily sensations, like increased heartbeat, as signs of danger, which then triggers panic attacks. Classical conditioning. Panic attacks may begin after a stressful or traumatic event. Over time, neutral stimuli, like a crowded room, become associated with the fear response. Personality factors. People who are more sensitive to stress or have anxious temperaments are at higher risk. Childhood experiences. Traumatic childhood experiences, like parental loss or abuse, increase the likelihood of developing anxiety disorders later in life. CHAR. Sociocultural and environmental factors. Stressful life events. Events like job loss, divorce, or a serious illness can trigger or worsen panic disorder. Cultural differences. The way panic is experienced or interpreted can vary across cultures. In some societies, physical symptoms may be emphasized more than emotional ones. Conclusion. Panic disorder is a serious and distressing mental health condition that involves both physical and psychological symptoms. Its causes are complex and multifactorial, involving genetic, neurobiological, psychological, and environmental factors. Understanding these causes can help in developing effective treatment strategies like CBT or medication. Early diagnosis and proper intervention can greatly improve quality of life. If you need the notes of this video, there's a download link in the description box. Be sure to check it out. Thank you. Let's see the next question. Question 7. Describe the clinical picture of 3 types of eating disorders and their treatment. Question explanation. This question asks you to explain how 3 types of eating disorders, such as anorexia nervosa, bulimia nervosa, and binge eating disorder, present in individuals. You are also required to describe their signs, symptoms, and how they are treated, using psychological or medical interventions. Answer. Introduction. Eating disorders are serious mental health conditions that involve abnormal eating habits and preoccupation with body weight and shape. The most common types are anorexia nervosa, bulimia nervosa, and binge eating disorder. These disorders can lead to severe physical and psychological consequences. According to DSM-5, Diagnostic and Statistical Manual of Mental Disorders, they are classified under feeding and eating disorders. Early detection and a combination of therapy and medical treatment are crucial for recovery. Main body ache, anorexia nervosa. Clinical picture. Anorexia nervosa is characterized by extreme restriction of food intake, intense fear of gaining weight, and a distorted body image. Individuals often see themselves as overweight even when they are underweight. They might excessively exercise or use laxatives to lose weight. Physical symptoms include emaciation, fatigue, low blood pressure, hair thinning, and absence of menstruation in females. Treatment. Psychotherapy. Cognitive behavioral therapy, CBT, is widely used to address distorted thinking about food and body image. Nutritional counseling helps restore healthy eating habits and body weight. Medical supervision. In severe cases, hospitalization may be required for refeeding and monitoring physical health. Family-based therapy, especially effective for adolescents. Bulimia nervosa. Clinical picture. Bulimia involves a cycle of binge eating, eating large amounts of food in a short period, followed by compensatory behaviors like vomiting, fasting, or excessive exercise. Unlike anorexia, people with bulimia often have normal weight, making it harder to detect. Signs include swollen cheeks, damaged teeth from stomach acid, dehydration, and electrolyte imbalance. Treatment. CBT helps break the binge-purge cycle and addresses negative self-image. Medication. Antidepressants like SSRIs, example, fluoxetine, are approved for treatment. Nutritional education promotes regular, balanced meals. Group therapy provides support and shared experiences. Teen binge eating disorder, BED. Clinical picture. BED is marked by recurrent episodes of uncontrolled eating without purging. Individuals eat rapidly, even when not hungry, and often feel guilt or shame afterward. It is the most common eating disorder and is often linked to obesity. Emotional distress and social isolation are common features. Treatment. CBT and interpersonal therapy, IPT. Effective in managing emotional triggers and building coping skills. Medication. Some antidepressants and anti-obesity drugs are used. Lifestyle modifications, involving dietitians and physical activity plans. Mindfulness and emotional regulation training helps manage triggers and cravings. Conclusion. Eating disorders can severely impact an individual's physical and mental health if not treated early. Understanding the clinical features helps in early identification, and applying appropriate treatment methods can lead to better recovery outcomes. An integrative approach combining therapy, medication, and lifestyle changes is most effective. As a society, increasing awareness is key to reducing stigma and encouraging help-seeking behavior. If you need the notes of this video, there's a download link in the description box. Be sure to check it out. Thank you. Let's see the next question. Question 8. Write short notes on the following in about 150 words each. A. Etiology and treatment of body dysmorphic disorder. B. Types of dissociative disorders. Question explanation. This question asks for 2 short notes. In the first part, you need to explain the causes, etiology, and treatment methods of body dysmorphic disorder, BDD. In the second part, you have to describe the types of dissociative disorders, including a brief explanation of each type. Answer. Introduction. Psychological disorders are classified into various categories, and some of them are related to identity and body image. Body dysmorphic disorder, BDD, is a condition where a person is excessively concerned about perceived flaws in their appearance. Dissociative disorders, on the other hand, involve disruptions in consciousness, memory, identity, or perception. Both require clinical attention and are recognized in the DSM-5. Let's understand both areas one by one. A. Etiology and treatment of body dysmorphic disorder. Etiology, causes. Biological factors. Research suggests that abnormalities in serotonin levels and brain structure, especially the prefrontal cortex and visual processing areas, may contribute to BDD. Psychological factors. Low self-esteem, perfectionism, and cognitive distortions about body image are commonly seen. Negative childhood experiences like bullying or criticism can trigger these beliefs. Sociocultural influences. Cultural pressure for ideal looks, exposure to beauty standards in media, and social comparison play a strong role in developing BDD treatment. Cognitive behavioral therapy, CBT. CBT helps the patient challenge distorted beliefs about appearance and reduce compulsive behaviors like mirror checking. Medication, SSRIs. Selective serotonin reuptake inhibitors, SSRIs, such as fluoxetine, have shown effectiveness in reducing obsessive thoughts and anxiety. Support groups and psychoeducation. These help reduce shame and isolation, and encourage acceptance and realistic self-image. B. Types of dissociative disorders. AIC. Dissociative amnesia. The person is unable to recall important personal information, usually related to trauma or stress. Memory loss is too extensive to be explained by normal forgetfulness. DO. Dissociative identity disorder, DID. Formerly called multiple personality disorder. The individual exhibits two or more distinct identities or personality states, often with memory gaps between them. Teen. Depersonalization या derealization disorder. The person feels detached from their body, depersonalization, or surroundings, derealization, like they are watching themselves from outside. They are aware that the experience is unreal, which distinguishes it from psychosis. CHAR. Other specified dissociative disorder, OSDD. This category is used when symptoms are present but don't fully meet the criteria of the other dissociative disorders. For example, chronic feelings of dissociation without identity alteration. Conclusion. Both BDD and dissociative disorders are serious psychological conditions that require timely diagnosis and intervention. While BDD stems from distorted body image and is treatable with CBT and medication, dissociative disorders arise from severe trauma and involve identity or memory disturbances. Understanding these conditions helps in better psychological support and management. Before we end, please like, share and subscribe the channel. And one very important information: if you want notes, check the download link in the description box. Thank you.